more. And today I'm having a conversation with Mark Ihrig. Mark is our Emergency Management Coordinator for Boone County. On March 13th, that was a Friday, I declared a state of emergency, a health emergency here in Boone County, and that activated our emergency operations. So wanted to have a conversation for the broader community to understand what that means. So Mark, tell us a little bit about what the declaration did and what it's doing today.
Of course, Judge, I'm happy to do that. That activated an emergency operations plan, which triggers a number of things. First and foremost is increased coordination and collaboration between our public safety agencies and local governments. It permits rapid procurement, which means that you are able as a chief elected official to secure supplies more quickly when they may be needed, as they were in this particular event, and notifies the state that we may need assistance, which again, we did ultimately with personal protective equipment. So those are the three main things that are triggered by the declaration.
Yes. And this being a health emergency, a lot of people have asked, did you ever plan for this? I know we do drills for tornadoes and floods, but did we ever do any training for a health emergency?
That's a great question, and the answer is yes. The health department takes the lead in a health emergency, as you might imagine. So we have an excellent health department in the Northern Kentucky Health Department. And we've had for years a pandemic plan, which we're able to fall on now and use to great effect. One of the things I'm most proud of is the way the Strategic National Stockpile flowed. When we needed supplies from the federal government, they were requested by the state, came into the local jurisdictions, and that just went exactly the way we had practiced it over the years.
The other type of emergencies that we normally think of, tornadoes, floods, you have mutual aid from other communities, but in this case, of course, everybody's dealing with the same challenges, so there's not mutual aid from other counties or cities. Everyone's fending for themselves. What other challenges have you seen through this?
I think there's two. First is that health has the lead. So we train over the years for tornadoes and floods and things of that character. But here, rather than public safety agencies in the lead, emergency management, fire, EMS, law enforcement, here public health has the lead. And so we take a little bit more of a support role in the logistics and in the planning of the things that they need. But the other challenge is just the lack of interaction face-to-face with people. We train to work in an emergency operations center face-to-face with our partners and make decisions that are of critical importance with their input directly. Everything's on phone and internet, just like we are now, Judge, and that's a little challenging sometimes.
So we're all ready to get open, get back to hopefully close to normal. What is your role in the reopening plans? Of course, that decision will be made by the governor. We don't have the authority to override his, but plans for reopening?
I think twofold. One is to monitor the trends, look at the 14-day trends so we're able to give advice on where we are on the benchmarks. And of course, the health department has a significant role there as well. But the other piece is to just help develop guidance for local business and industry to reopen. My biggest concern, Judge, is that we open and then we see a surge in cases. And unfortunately, that could set us back. And I'd really like to see us collectively, and I think we are doing this now, working to make sure we do it right the first time as a state, as a region, as a county, that we don't have to take any steps back. We open and we stay open.
Amen. Let's get it right. Let's make sure when we open, we stay open. And want to thank all of our businesses, all of our employees, everyone who are making sacrifices. And our thoughts and prayers go out to each family that may have lost loved ones or have been fighting sickness and illness due to COVID-19 and other things. So our thoughts and prayers are with you. So Mark Ihrig, our Emergency Management Director, thank you for all you and your team have been doing. And thank you to the broader community. God bless.